The Pallium project has evolved into one of Canada's most robust examples of a community of practice. COPs are collaborations of people who share specific interests and practices and work together to advance their specific area of practice. A COP reflects a long tradition of working together in Canada among neighbors and within communities to share resources, energies, and efforts in mutual interdependence of common goals. It reflects a great paradox of our times. The simple idea of diligently working together to reframe the complicated question of how can we afford to provide services to an aging population into one which enables us to navigate the complexity of ensuring that systems of care are available when patients and families need them. In this report back to stakeholders, several collaborators in project activities share insights about the project's work, results to date, and the difference it is making.
We know that we have some crises around Aboriginal needs, and diabetes is their terminal illness, and that's not right.
I think the potential is there to highlight that as Aboriginal persons we have something to offer to the total vision in the society around palliative care. I think we have been recipients of clinical models of care and of Western medicine. And in this particular project, I think we will now move to another level of participation and make some contribution to the Pallium project.
There have been people that have identified new learnings. We had one woman stand up in one of the communities in northern Manitoba and say, I've worked with Aboriginal people my whole life, and this is the first I've heard of the impacts of colonization in residential school. There was, I think, profound shifts for people.
I think the whole concept about the schooling and history, I think we have preconceived ideas about what it was like, but to have it actually explained through the eyes of somebody who's been there and done that, and then who has moved through our system, the more Western system, has been very insightful for many people.
We have a huge Aboriginal population up north. And it was a shock, more than a surprise. It was a shock at the number of people that attended for the day that were really naive and truly did not understand.
They had never thought of residential care having an impact on a healthcare system and the care that was expected and the trust or mistrust that they put in white caregivers.
And we're really hoping that it really brings us together, because there has been divisions, just cultural divisions, lack of understanding, and there's been several attempts to bridge those gaps.
I think what it did that day was really develop the respect for some of the challenges that our Aboriginal population have faced in the past, and how those challenges are still extremely influencing their lives today.
We burst some myths for some people, so they have to re-examine some of their philosophies and some of their beliefs around Aboriginal needs. And I think that people are now saying to us as a region, what are you going to do? We need this support, we need this help. What sort of programs are available to us?
This workshop has really spurred on the cultural learning curve in our region, both in terms of culture for the Aboriginals and also for palliative care.
This was a bit of a first taste for people, and that it just made them aware of how much they don't know in terms of working with the Aboriginals. So that's huge. I mean, if we can do that, the rest will be easy.
you.